This is a great event. The Minority Health is always doing something good. We one of the churches that work with them, pass out food with them. Good idea for Black men especially.
It's a breath of fresh air when other men are taking into account their health and putting their health as a priority. So it's some good energy that I've seen thus far.
Black men in period, are not coming to seek help because of fear, right? So going out into the community, building that trust, establishing those relationships, and once you meet them where they are going to come to you for support and to continue to develop and thrive.
I'm so glad to be here. I serve as the Executive Director for Magnolia Medical Foundation, and I'm glad to be here to support Dr. Sandra Melvin and the Institute for the Advancement of Minority Health in this men's conference. It is wonderful, it's wild, education's going forward, men are being empowered to think about their health, their wealth, their mental status, emotional and physical. So I'm grateful to be a part of it, and shout out to the Institute for such a great conference.
Well, I feel that it's important that men, that we pay attention to our health so we can live some long and healthy lives.
If we start early enough, educating our young men, educate them as they become young adults, we're hoping they'll take these things into account and take care of their health in a better way.
African American men are the most underrepresented in research. However, they are the ones that are most impacted by disease processes such as Alzheimer's disease and related dementias. We think that this is an awesome opportunity to meet the community where they are, and that just making sure that our men as well as our whole community understand better the things that impact us and what we can do to correct those things.
I am very passionate about mental health. I believe that mental health is the foundation to a well-built society, a person, especially Black men and minorities all together. And so once we have not just our mental health, but our physical health, then everything else will fall in line.
Together, we are here to learn, to build, and to chart solutions that will transform lives and strengthen communities.
Need to know their tire pressure. Their tire pressure, more than blood pressure. And so we just gotta know our numbers and make correct steps to be good for our families.
They are limiting politically your resources, your money to be able to take care of things that can better help that community, because here again, if they can keep you oppressed in your mind, in your physicality, of course, it cuts out the access to better health care, the access to health literacy. The less you know, the better for them.
For me, one of my biggest things is going around and educating people, or getting people to get educated about themselves. Don't just listen to the myths. As Dr. G has said, they're cutting back on education and stuff. So we must go out and be proactive about ourselves and get what we need so that we can be better.
Up to 9 out of 10 people don't know they actually have it. And why don't they know? Because they don't necessarily know their numbers. These are easy tests. It's a urine test, it's a blood test. You can get it every year when you get your annual exam. Know your numbers. If you have hypertension, if you have high blood pressure, if you don't know you have it, because again, it's one of those diseases where there's often not a lot of symptoms until it starts creeping up too high, and maybe you get the occasional headache or something like that, but most of the time, you don't know it.
So there has to be a level of personal accountability to say, I am going to reach out to my friends, my loved ones, and say, no, come with me. And then if they're not here, then you go to them and say, hey, have you gotten checked up? If they're over 50, have you gotten a colonoscopy? How often you get your blood pressure checked? Have you gotten checked with this? And so that one-on-one peer conversation has to take place. If that happens, and then you begin to replicate that, and it goes from group to group to group, then I think you're going to see a dramatic change. But it has to start with one. There's been no revolution in the history of the world that ever started with group consensus. It always started with one person who had an idea, who told somebody else, who told some other people, and all of a sudden it happened. That's how revolutions began, and the same thing can happen when it comes to health revolution for Black men in Mississippi.